Longevity Plus would like to thank you for joining our webinar today. Dr. Gary Gordon is an expert on nutrition, mineral metabolism, and anti-aging. He is a consultant to Longevity Plus, where he is responsible for designing effective natural supplements that help to support optimal health. Today, Dr. Gordon will be discussing energy medicine with Dr. Alan Unruh and Dr. Sue Massie. So without further ado, please join me in welcoming Dr. Gary Gordon.
Welcome back, everyone, to what I think is an extremely important topic. I believe, without question, by adding my fight program to things like PEMF, I can, without question, deliver better results with any chronic degenerative condition, whether you're talking about diabetes or Alzheimer's or Parkinson's or autism or arthritis. It makes no difference whether it's one of the autoimmune diseases or one of the cancers. We can deliver better results. Try to understand why. If you start to determine in your own mind what you think are the major contributors to a sense of dis-ease in our population, we know the population has become very restless. And so you could look at all the riots and the things going on worldwide, and you could say, well, maybe it's because we put so much lead and mercury from the burning of coal that everybody has low-level lead and mercury poisoning, or because we put all of our drinking water for much of the world into plastic bottles and we gave everybody phthalate and bisphenol A toxicity, which then changed our genes overnight so we can't methylate, and that means we can't get rid of the toxins because we know that chemicals and pesticides are in every human being in rapidly increasing amounts. The phthalates are over 10,000 times higher than what they were, and the lead in our bone is well over 1,000 times what it was. But other people will say, yes, I could tolerate all that, but you know, we've washed all the good trace minerals into the ocean, and no, everyone is trace mineral depleted. Farmers are paid by how big the tomato is, not how nutritious it is. Meanwhile, Monsanto has contributed to the whole problem with genetically modified, because that has caused their food raises a pesticide in that corn, and when you are consuming that corn, you're getting another chemical called Bacillus thuringiensis that's disturbing your intestines. So the list goes on, but you don't know anything about this slide, which you have to look at it and realize what it's saying is that we have, without a doubt, a possibility that the North Pole will become the South Pole, as it did quite a few years ago. Fortunately, we may have time yet, but it's important to know that the Earth's magnetic field has waned 15%, but in reality, back at the time of dinosaurs, experts believed that we had 20 to 30 Gauss. That's how strong the magnetic field is, and today we're down to 0.3. At 0.3, obviously, that's 1% of what it was. Why do I make such a big deal out of it? Well, when the world is changing so that Australia breaks off of the European continent and these things change, a lot of changes go on. And we know when there isn't any magnetic field that metabolism in your body stops and you can't get off the floor. So there's a lot of changes going on, and that major protection of our globe is that the magnetosphere protects us from solar storms. Now, that's going to lead to a little period of time here. If we have the time to think about it, we see birds falling out of the sky by the thousands. And people have different theories, but scientists who understand this could have predicted, because we know that when the magnetic field has been disturbed, the ultraviolet radiation soars, and that the ozone is being depleted rapidly, and we're all starting to be exposed to gamma radiation, as Dr. Dean Bondley covered so well in last week's presentation on magnetism and health. I hope you review that webinar, because you will learn why. If you didn't do anything more than buy a magnet to put in your soles of your shoes, or a magnet the size of a small pocketbook, at least you would be doing something to learn from today's very important lecture to you, because we have clearly seen that NASA scientists are getting a little worried. There's changes going on much more rapidly than anything they expected, and there's a breach, and that breach is causing the ozone layer to get a huge hole, and when that has a hole, the net result is that we have a tremendous exposure to gamma radiation, which, if you wound up sleeping on the right kind of magnetic pad, you would be significantly protected against things that are happening. For example, clearly anybody spending what I spent for my king-size bed, $3,600, has changed my life because my body is handling toxins more efficiently. But today we're going to go into what can I take from that little bit of knowledge that's affordable to a lot of people. Even though $3,600 is a lot, it's $1,800 for a single bed. But the bottom line is that when we take these $20,000 PEMF units, they can be leased for $500 a month. That's $125 a month to 4 people, and 4 families could change the health of everybody in the family. Because today, I'm not just talking about the birds dropping dead. You need to understand, I'm showing you the birds dropping dead so you understand that even the runway in Tampa had to be renumbered because the North Pole is moving some 40 miles. And that's happening because you and I are on Earth at the time of an Earth change. So if you go to my website and you download my FIGHT program, 18 pages as written by Scott Forsgren, you'll be in a position to know why I'm so super confident that any disease, whether it's ALS or Parkinson's or autism or obsessive compulsive or depression or anxiety or hypertension, I don't care what the chronic disease is, this program I'm outlining to you is life-changing. I am a new person in less than 3 months of using the device called a PEMF because of the exciting research that this device has behind it. We now can safely state that this is going to change the life of everyone who now is stuck with stupid drugs for their pain. When surgery, you don't want surgery for back pain. I have a brand new back. You don't want to go near these guys because they're not treating causes. I'm giving you the overview of causes. The weakened geomagnetic field has knocked our immune system down so that we can't keep all the bugs down. And we have virus and fungi and candida as well as lots of bacterial infections, and we have to keep these under control. And that's why it's important to combine the knowledge from my FIGHT program with what we know we can teach you here. But PEMF has been around now for some time. Remember, it's been FDA approved in this country for healing non-union fractures all the way back in 1979, and urinary incontinence and muscle stimulation in 1998, and now it's approved for depression and anxiety in 2006. It was approved many years before that in Europe, so we have thousands of reports, and it's important for you to look at the literature because I don't care what health problem you have. There is going to be a tremendous change in some people in one treatment, but that's not the big change, because I'm telling you this will do more. For I don't care if you have aplastic anemia, I don't care if you have leukemia, I don't care what the diagnosis is, because only by raising the magnetic field to its optimal will you move the toxins out and the nutrients in. Now that's because we normalize the cell membrane potential. We allow the normal intake in the cells of minerals that you need. We excite the atoms with an increase of what we call the ATP of the cell. And when the ATP of the cell is up and the pH is made alkaline, you have more oxygen in the cell. Everything is working better. And so it's really important to understand that everybody in this world faces, as you live longer and longer, some form of osteoporosis and osteoarthritis and some kind of bone and joint disease. And we have an epidemic of people who either have an elbow that doesn't work or a shoulder, a knee or something. And we don't need to replace everybody's hip and knee. We can actually solve the problem. So although you could bankrupt our country by giving everybody a new hip and then another new knee and then maybe the other hip, or you could treat what's wrong so that actually the hip starts to heal and it comes back to normal and the bone comes back. 20% improvement in bone density in months have been reported by some. So across the board, whether we're talking depression, which is now being done at Stanford University and at Yale University and at UCLA, they're using a device that costs $60,000 instead of the $20,000 for the one that I like. And the $60,000 one only lets you treat the head. It won't treat your bad knee or ankle or help restore your liver to health, because the liver is where all our toxins are headed. So this is a great unit. But if you're going to have insurance and it pays $12,000 for 6 weeks, everyone really could stand 6 weeks of treatment. But how can we make it affordable? Well, what if we have 4 families that are neighbors that all have Lyme disease, and they share this so that each one of them has it for a day or 1 week out of the month? I think there's a way of getting this exciting device in the hands of all of us. And at this point, I am wanting to go and introduce all of you to a practicing chiropractor who's practiced for over 40 years. Dr. Unruh is on the phone, and we have Dr. Unruh, and we're going to bring him on now so that he can give you his overview, because no one sees more bone and joint and bad backs than a chiropractor, but here's one who's been smart enough to bring the PEMF into his life. So Dr. Unruh, are you there? If we're not able to get Dr. Unruh today, he's having a conflict with other meetings, we will be happy to switch over and have Dr. Sue Massie, who's got an exciting story to share with us. Sue was paralyzed from the neck down, and she was thought to have ALS. And her husband wound up having heart surgery, and her children, 6 of them, all had shared Lyme disease. Then in 2005, she developed the breast cancer. She's the picture of health today, having gotten her naturopathic degree, and Sue Massie will be able to share with us some of the experience that has caused her to buy a PEMF and start treating patients who have serious problems with a PEMF.
Hi, everybody. Thank you for joining us today. I am very excited to be a part of this presentation, and I thank you for inviting me. As it says here, the reason why I purchased the PEMF is because I got a call from somebody a couple of years ago asking me if I knew anything about PEMF. And being working in the Lyme field for 15 years, as Dr. Gordon said, after recovering, somewhat recovering at that point from Lyme disease, from being critically ill, paralyzed, and so forth, my husband and all 6 of my children, I figured this is another new avenue. And when we all, if you've ever suffered with a chronic disease such as Lyme, you know you keep going to the next thing, looking for the miracle cure. So when I started to research PEMF, I came across this particular machine, was introduced to it, and something just struck me. I had a woman, one of my patients in Canada, who was wheelchair-bound with ALS/Lyme disease. Well, I just took a stab in the dark, gave her a call in Canada, and said, listen, I've learned of this new, to me it was new, the PEMF machine, and I think it would be a great idea if you traveled to the States, out to Colorado, where this was being presented, and I think it would be a shot in the dark, but, you know, when you're desperate, you'll do anything. And she called me back about 20 minutes later and said, yes, my husband said, we're going to go, but you're coming with us. And I'm in New Jersey, and I said, well, that's very nice, but I can't possibly go with you. I'm very busy with my practice and 6 children, et cetera, et cetera. Well, the next thing I knew, I was on a plane to Colorado, because I figured this is just one of those things that's too good to be true, but I'm going to go check it out firsthand. So there I was in Colorado. They showed up. My patient and her husband and the people that were presenting the PEMF, and Diane could not lift her arms and so forth, and her neck was very stiff, and she was in a lot of pain, but just you know, it was just an amazing experience. So they went ahead and used the PEMF with the different coils and so forth, and instantly after a 4-minute treatment, she lifted her left arm for the first time up over her head. We all started crying. It was like an amazing thing, and I'm like, okay, this is too good to be true. Well, we ended up spending a week in Colorado, staying there, working on avenues of detoxification and building and so forth, but they were so convinced that this machine actually was a positive result that they purchased one. Well, I returned back to New Jersey, and within about 2 months, I ended up purchasing a machine for myself. I came home, I was so excited, and all I could think about was, this is going to help my patients. There's something with this, I told my husband, we're going to have to, somehow come up with the money, which we did through a home equity loan. Thank goodness back then you could still get them. And, I ended up purchasing a machine, and then I started, as I saw my patients, I let everybody try the machine to see what kind of result would a person get. Now, I deal mostly with Lyme disease patients, but I also deal with rheumatoid arthritis, autism with young children, various diagnoses. I am not a medical doctor, so I don't, come in with diagnoses, but they come to me with these different situations, and we have used the PEMF on a multitude of people. Another patient of mine that's about an hour away, she was coming to me for about 6 to 8 months, 7 months or so, diagnosed rheumatoid arthritis in her late 30s. Her fingers were so badly gnarled and pushed to the right that she was having a hard time picking things. She couldn't pick things up. It was just really impossible, and she had a young child. And so again, we did about 7, 8 months worth of treatment with her on the PEMF, two times a week. And the next thing, she just, her fingers, the swelling went down. They started to straighten. I could not believe it. I've seen videos of these things, Parkinson's also. I've seen Parkinson's, use this machine and stop the shaking. That nervous shaking, which Lymies get also, Lyme disease people. Anyway, so the PEMF helps reduce the pain and inflammation. That's the #1 thing that I just love about this machine. I had a woman come to me with Lyme, quite ill. Her husband said, no, I don't have Lyme. He just accompanied her, but he said, Dr. Massie, I do have severe low back pain. So I said, great, lie down. Let's throw the coil on you, and let's see what happens. He said, oh, no, nothing's going to help. 20 years I've had this pain. So again, we put the coil on his back, and the guy stood up after a 4-minute treatment and could touch his toes and was absolutely amazed. Now, I do not want to mislead and say this is the cure, 1 shot and you're cured, but it definitely lasts for 3 days. That's been the average result of relief for the patient. So while you're relieving the pain instead of prescription drugs, what a wonderful thing, because then you can still work on the detoxification, clearing toxins, and feeding the organs and cells to get the body in a healthier position. So it repairs damaged and diseased tissue. It increases your cellular level of oxygen, which we know as in something like Lyme disease, that you are just hypoxic. We call it air hunger, hypoxia, and so forth. Okay, you also go on some other health benefits, poor blood flow to the brain. Again, Dr. Gordon talked about depression, mood disorders, brain fog. I hear that a great deal. Hypertension improves the myocardial, your whole coronary heart system stimulation. Hypercoagulation, Lyme disease people get a condition called the thickening of the blood, the hypercoagulation, due to the inflammation. The inflammation creates nitrous oxide, which causes a hyperinflammatory response, and that's where you get that excessive fibrinogen. The PEMF, again, brings energy to the cells, dumps the debris out of the cells, and cleans up the internal system. Joint and cartilage damage and deterioration, again, with severe degenerative joint problems, they usually give you steroids, which are damaging to the adrenals, and it just suppresses the immune system. So they're not beneficial, but in this case, you use a machine which has no negative effects on the body whatsoever. I'd say it's like a big battery charger, and what it does is it charges your batteries, which is all your little cells. So it gives the body energy. It also helps with depression. Most people have, they experience what's called a Herxheimer reaction, whether they're doing antibiotics, holistic, whether it's a silver or a salt vitamin C protocol. And again, what they do is the doctors prescribe medications for this. Again, with a simple use of a machine for 4 to 8 minutes, amazing results. It brings that circulation to the brain again. Insomnia, huge problem. Many of my clients complain they cannot sleep, the insomnia problem. So again, increases the blood and the fluid, the brain, the thyroid, and even the lymphatic. Repairs the nerves for all those people with neuropathy, the hands and feet falling asleep and so forth, works fantastic. And there's just a multitude of additional benefits of the PEMF. We've used it in conditions of endometriosis, osteoporosis, Parkinson's, sciatica, any type of pain disorders, people with just recent surgery. It helps tremendously in healing time, whether it's a abrasion or a break, sprains or anything of that sort. It's just amazing machine. And as Dr. Gordon says, the amount of money that people spend on supplements and going from doctor to doctor, it's just an amazing situation. So I'm a very big component and supporter of the PEMF. I find it to be the best tool that I have invested in thus far in the last 15 years, not only for myself, when my son, who has my 15-year-old, gets some stomach upset and so forth about Lyme, what happens is he'll come home from school, throw the PEMF on his stomach for 4 minutes, and he goes out and skateboards. It's all that pain and whatever's going on seems to diminish. So it's just wonderful overall, like I say. For anti-inflammatory, it helps the pH of the body. It increases your oxygen, which is one of the biggest things. It works as a catalyst to increase your bone density, your muscle mass, which those are very critical with ALS and multiple sclerosis, and various things of that nature. So I just find it to be an extremely beneficial machine. Like I say again, it doesn't do it just on its own, but it's a wonderful tool. I feel in the world of Lyme, and in my humble opinion, that would include multiple sclerosis, Parkinson's, fibromyalgia, chronic fatigue, lupus. All these degenerative neurological diseases have an origin in something. And in my opinion, I believe it's pathogens, and I think our bodies are so knocked down, as Dr. Gordon said, with severe toxicity and so forth. We don't have the electrical energy in our cells, in our body, to take care of getting well. So with the addition of an electrical device like the PEMF, it's a big battery charger. It charges our cells, which are dead, nearly dead. Of course, obviously, some have a charge, or else we wouldn't even be able to move, but it just brings amazing energy. And I just saw a husband and wife about 2 hours ago in my office that just purchased a PEMF 2 weeks ago. The wife was not in good condition at all due to Lyme, on many medications, had very little energy, and in just 2 weeks, today she is a totally different person. They were so excited to get their machine. They can't believe the difference. It replaces the oxycodone and whatever, and it's just an amazing thing. So now it's a matter of working on detoxification, with the wonderful supplements and so forth, the different organs, and build the body, and switch her over from this depleted, disease-ravaged person into a healthy, strong immune system, good energy by her own cells, to be a person and to go on with the purpose of what she's here for. And that's my focus with every one of my patients, no matter whether they're babies or my oldest client is 96, and she still lives at home, fully functional and so forth. And I attribute it to, this product, the PEMF, just does amazing things. So I thank you for your time, and I just find this to be an amazing situation.
Hello? Hello?
Dr. Unruh will be unable to join us.
I'm on.
Oh, Dr. Unruh.
Yep, I'm on. Hello? This is Dr. Unruh. This is Dr. Unruh.
Hi, Dr. Unruh. Hi there.
How are you today?
Well, I'm doing great. I'm so glad you were able to get free to be able to join us.
I'm glad to be here.
So I have introduced you by saying that who would know better than a 40-year practicing chiropractor of how much of a change PEMF could do to somebody's practice, because my position that I told everybody before we got you on is that there is no chronic degenerative condition that we can't treat better than anyone else on the planet than those of us who are lucky enough to do a detoxification nutrition-based program and add PEMF. So I see that you have a thought that PEMF is the energy medicine, and I thought I would turn it over to you and let us hear from you. What got you interested and what's going on with your experience?
Well, we've always tried to invest in the latest technology to help our patients recover faster. We live in a day and age where the second leading cause of death in America is drugs, the side effects of prescription drugs. Drug industries, the people hear 27 times a day that relief is a swallow away. Why coke, take dope? You don't have to face up to pain, discomfort, hardship, adversity, or disappointment. Just pop a pill, and you'll escape to serenity, happiness, and satisfaction. There's a pill for every ill, a potion for every emotion, but the problem is there's 4 pages of side effects for each one. So what if there was a way to treat the patient that had no side effects, that utilized the natural recuperative powers of the body, that was quick and safe and effective, that recharged cells that are damaged and quickly took away pain? Any doctor nowadays is looking for ways to help their patients recover faster who have chronic pain and even acute pain with inflammation. The unique thing about this is it's not invasive. It only takes about 9 to 12 minutes per patient. It's very user-friendly. And if a person has a torn rotary cuff to a knee problem to a post-surgical case, I've had people, one woman who had 3 broken bones in her foot that weren't healing for 6 months. And she couldn't walk or put any weight on her foot. I said, why don't you come in and get some PEMF therapy, the pulse magnetic treatment? It's the only treatment I know that can help those tissues heal. Come in every day for a month. I said, what do you got to lose after 6 months of misery? So she did, and not only after a month, she quit her crutches, she walked without pain, no limp, and completely recovered. She said, I can't thank you enough for investing in this technology. When you get patients that have had failed back surgery, but then when you can help somebody who has multiple sclerosis or Parkinson's disease, or if they've got a brain injury like autism and cerebral palsy, and you can even help someone like that medical science has completely given up on, that they have no idea how to treat, it opens up a whole new world for the amount of people that are chronically disabled. And so to have things that offer to expand your scope of practice, you know, doctors nowadays are thinking, what can I invest any money in that could possibly have a return on it? Because you invest in the stock market, the dollar's dropping, the value of everything's dropping. What can I do to help my patients recover that will expand my economic opportunities to even help more people? Well, you know, 10 visits is, we charge like $350, and we throw an extra visit in free. And 85% of the people notice improvement the very first visit. So whether you're treating athletic injuries with muscle and tendon injuries, or whether you're treating chronic back problems with disc problems, or whether you have a nutrition practice where there's chronic problems with joint problems and degenerative diseases, this offers help for all patients. There's no contraindication other than a pacemaker because it's electromagnetic therapy. Every cell in our body has a positive and negative charge where potassium, sodium, and chloride gets exchanged in the cell membrane. When we walk, our arms swing opposite our legs. You can't walk with your arms swinging with your legs. If you move your hand in a circle clockwise real fast and try to move your right foot counterclockwise same time, can't do it because it's all electromagnetic circuitry. 4,600 miles of nerves control the human body. The purpose of the nervous system is to control the function of all the muscles and all the organs. With 300,000 nerves firing between each vertebra, and they fire 300 miles an hour, and you think about the whole electromagnetic principles of how the human body functions, anytime there's chronic pain, obviously it means there's inflammation. Inflammation glues connective tissue fibers together. It impairs circulation. Nerves don't get oxygen. Anything that dilates the capillaries to get blood supply and oxygen to a nerve helps the body recover from pain. Plus, it softens scar tissue. it gives oxygen to the cell. So on a cellular level, there's nothing that will stimulate the recuperative powers of the body greater than this. And so, I mean, if you see 5 or 10 people a day, if that's all you see, but every patient needs it. I tell all my patients you recover twice as fast if we do pulse electromagnetic therapy with your treatment. And they usually pay cash for it, and once they experience it, they'll be glad to help recover faster. So that's what's exciting about it. And the CA does it. We're training them where to put the treatment and how to use the therapy. And we start out gently, depending on how hypersensitive a patient is, because some people have severe pain for a long period of time. And to be able to offer something that helps these patients, and you're the only unique service. I read a book the other day, Differentiate or Die. If you offer a unique service and you're the only person in your area that offers it, these people who've been helped are going to refer others. You're the only clinic that offers this service, and it puts you a cut above the rest and helps just so many people recover faster and feel better, and that's what healthcare is all about.
You know, I'm really very glad to get this feedback from you, because it is my contention that if we required anyone being scheduled for elective back surgery, if we required them to first have 5 treatments with a PEMF, the neurosurgeon and orthopods would lose 80% of their business at least. Do you agree with that?
Well, that's right. That's right. You know, naturally, nobody should ever have surgery until they've tried this for a month first, because surgery is forever. And 50% of the people who have back surgery have the same back and leg pain within a year. That's on the ones that are successful. And the best way to prevent a second surgery is to not have the first, because once they start cutting on the spine, that's where the whole nervous system is. I mean, they do a good job sometimes with putting a new knee in or a new hip when it's completely gone, but the spine is different. That's where all your nerve headquarters comes through, from the brain through the spinal cord. So nobody ever should ever submit to surgery. It's like swatting a fly with a sledgehammer. You don't need a drastic approach. Let's let the recuperative powers of the body. I just had a patient in last week. She said, "Doctor, I was scheduled for my neck fusion last week," she said. And the medical doctor, the orthopedic surgeon, and the neurosurgeon both said, "There's no way chiropractic can help you. You got to have surgery. And you'll be paralyzed to go to a chiropractor." I mean, she's scared to death to see me, but not scared to let him chisel on her neck. And I said, "Listen," I said, "you let me work on you 1 month, and if it doesn't help, you can always have surgery. But give this a try for just 1 month." And 1 month, all her arm pain's gone, her neck pain's completely gone. She has normal range of motion. She's no longer on any meds, and she feels fantastic. So she wrote a testimonial for me, and then we're going to send that to her medical doctor who said chiropractic can't help. And so that's what's exciting with these people, and they're going back to them and telling them what the truth is.
You know, I'm so convinced that everyone would be healthier if we restore the missing electromagnetic field that the Earth is losing, that I would make the following statement, that anyone who is not improving when they get PEMF treatment, that the only reason for it is because there's an obvious problem, such as gluten sensitivity, so maybe their Crohn's didn't stop, or their ulcerative colitis, or there's somebody's got dairy sensitive, or they have a mouthful of mercury. Sometimes the patient does have to use what I call my key program, my FIGHT program, where you look at the food sensitivity, the infection, genetics, heavy metal, hormone, toxin. But if you look at the obvious, then there has to be every patient receiving PEMF will see a clinical benefit. In your experience, were there any patients that for the first month you just saw so little that you were about ready to give up, but then the second month it kicked in? What has been your experience? Would you say 80% see something in the first week, but some people, 5% never saw a benefit till the second month? Well, what's been your experience?
Well, see, you got to look at how long. Some people have been suffering for years, and they develop what they call maladaptive neuroplasticity. Now, that's a $100 word, meaning the body's trying to adapt to the way the spine has been deteriorating. Now, you can't reverse that in 10 minutes. You can't run around the block and be in shape tomorrow. It's like that commercial that shows the fat guy got on the scale and he ran around the room and got back on the scale and hadn't lost an ounce. See, we're indoctrinated for the quick fix, the magic bullet. We pace in front of a microwave. Nature takes time. And I explain that to people, that we're gradually changing the molecular structure of the cells, and that's why every case is different. We can never predict how rapid anyone will respond, but if they have the patience, patience is a virtue. Our patients need patience, and if they follow through, the body has time to recover. And so we have a lot of different things. Sometimes we'll use some laser with it. Sometimes I'll do the Cox distraction instrument. We'll do deep muscle stimulation, but the pulse magnetic recharges the cell. So I tell them, if I can realign your spine, and then the magnetic energy helps the cells to heal, they're going to hold better. And it's the one thing that will help you recover to maximum ability. Now, some people, you can't make them like new because they're 80 years old. But I got an 85-year-old that's had pain down to his foot for 6 months. Injections didn't help. They told him his surgery he'd probably die of a heart attack because he had a bad heart. But he couldn't stand the pain either. I told him, you got to come in every day for a month, and we did the spinal decompression with him, and we used the pulse magnetic treatment on him, and we did some different modalities. I got tests for free radicals, like sometimes they've got bad nutrition. All these things influence how the body recovers, and so you try to do a multifaceted approach to look at every angle, what they do for a living, and modify their activities of daily living. And so as a doctor, the word doctor means teacher. Our job is to teach them how to help themselves recover faster. They can't just depend on you. They have to participate in their recovery. If they have the patience and they do what you tell them to do, 90% are going to get better. And so you tell them, I don't try to oversell. Some people get 25% better. Some people get 50%. Some people completely recover. And so what's exciting is when you can help them without drugs and throw the pills away, that saves them a lot. It takes way less investment. Look what pain clinics cost for pain control, teaching biofeedback to learn to live with your pain, thousands and thousands of dollars. And what we do is all natural. We're talking hundreds of dollars. And so it creates a great opportunity for people to recover, tremendously expands your service to your patients, and with very little investment. I mean, if you see 2 people a day on it, it pays for itself in no time, let alone 5 or 10 or 20. And the average person could put every patient on it and see how it works, and that's what's exciting about it.
So would you say your average treatment time is around 10 minutes, or where are you at with your average treatment time?
Yeah, 10 to 15 minutes.
And when you have an average patient that say they're coming in with back pain, are you going to be treating several areas on the body generally?
We try to concentrate on the 3 most prevalent painful areas. And then our goal is to get 50% improvement in a month. And
so if it's a back pain patient, they may be treated in 3 different areas for 3 to 4 minutes each area.
Absolutely, absolutely. And then we rate the pain, and sometimes you can test the muscle before and after, and you can check the range of motion before you treat them and then after you treat them. And when you demonstrate how their range of motions improve, and you have them rate the pain if it's on an average of an 8, and then a month later they rate their pain an average of a 4, you've got 50% reduction of pain. I got pain threshold meters. We can tell how sensitive by a meter they can put pressure against where their most painful area is and how much it's improved. So you even have some objective ways to demonstrate to the patient how much better they've gotten when they came in. So it's exciting when you do that and people say, wow, this is great. I'm walking better. I'm sleeping better. I mean, when they're up a half a dozen times a night because the pain is waking them up, and now they sleep and it'll wake up once a night instead of 6 or 8 times. What's a good night's sleep worth? Everything. And so you improve their whole quality of life improves, their countenance improves, their energy level, their relationships improve, their ability to be a productive citizen at work improves, their social life improves. I mean, there's no limit to the benefits of what we offer.
would you find, if the patient lives quite a ways away, that you could still help them even if you only get them in once or twice a week, or do you need daily for that first month, or what do you find?
Well, I've got a lot of people. Like I got one woman, they want to fuse her neck and lower back, and she drives 4 or 5 hours. And I got about a dozen people right now that drive 3 to 4 hours to come see me. And I tell them, okay, for the first week, I want you to come in every day, just stay here for a week and get a motel room, and they do that. And they might do that for a couple weeks. It depends how severe a month's pain they got. Like the one woman, they wanted to do these fusions. In 2 weeks now, she's back to work again. But she's taking Thursday and Friday off and coming in and stays overnight and gets another follow-up treatment. But she's just elated and feeling fantastic. And see, once they say, I can't tell you, Doc, how much better I'm feeling, I'm starting now collecting all these testimonials and proving, and then just so they can share with other people who are hurting the importance of investing in their health, because really without your health, you got nothing.
Do you find...
Yeah, they'll stay, you know.
Do you find after you've gotten somebody out of a tough jam, say at the end of a month, do you like to have them come in at a minimum of once a week or every 2 weeks for a while to be sure they keep going uphill?
Well, yeah. Once you treat them until they plateau, until they say, okay, I really haven't changed a lot, and they say, well, let's make sure you never go backwards. They come in once a month. Some people, it depends how chronic they are, will come in every couple of weeks for a while. But then once a month, I say we got 2 philosophies. You can wait till you're hurt real bad, then come in for a series of treatments, or you can get a periodic treatment to keep stress from accumulating, because the only people with no stress are in woodlawn cemeteries. And so you got to live, and people they slouch all day in the couch or a chair, and they bend, stoop, twist, and lift. They don't take care of themselves. So if they do that supportive care on a regular basis, they can keep ahead of any stress that may be accumulating and stay healthy all year just with a once-a-month treatment. Or they have the prerogative to wait till they break down and then come in for a series of care to get care. But either way, we don't try to pressure them. We say it's up to your philosophy. You're welcome to come in. We don't want to make them feel guilty if they're not coming in all the time. But once they feel decent and they feel good, they don't need near as frequent a care.
Would you sometimes be tempted to go above a 10 or 12 minute because of the severity, or are you afraid of Herxheimer or other healing reactions if you go too long?
Well, no. I mean, if you've got a person that they've got serious problems, we charge $35 for 15 minutes. If they want to go 30 minutes, we charge $50. So for an extra $15, they can go a half hour. Because some people, if they drive a long distance, they want more care, you know. And so because of the distance they drive and they can't come in as much as normally we would have them come in, then we'll give them a half-hour treatment.
When you go to a half an hour, do you still stay at only 5 or 10 minutes at a given one location? You just go to more locations?
We go to more locations. Like we had one guy, he's had multiple foot surgeries. His feet are killing him. He's climbing ladders all the time. He's an electrical engineer and fixing telephone poles out in the wintertime, and his cold feet, and he's got multiple surgeries on his feet. Medically, there's nothing more they can do. They can't keep doing surgery on him. So the pulse magnetic treatment, he'd get a half-hour treatment. He'd do his foot, then he'd do his knees, and he'd do his legs, and his groin, his low back, because his hips and lower back hurt like everything. So he'd get a half-hour treatment, and he loved it. And so at least it's the only thing that's helped him. I mean, when you've tried drugs and injections and surgery and you've tried everything, it's great to have something you can offer these types of people that have been everywhere, and nobody's helped them.
Is there anyone that distinctly had what you would call a cleansing or a healing reaction, where for a day they were kind of Herxheimer, or they had a fever or a rash or an old herpes activated? Was there any time you thought that you were seeing some cleansing Herxheimer type reaction from the treatment?
Well, you know, I've had some elderly people with arthritis that they were hypersensitive, you know, at first. And so I tell my staff just to go very mild on some people, because Some people are really hypersensitive. They got what they call denervation supersensitivity or type 3 pain, and where the nerves are so hypersensitive because of fibrotic tissue that builds up inside and around the nerves. We've had a few that had a reaction like that, but you live and learn with every patient. Sometimes you just have to modify your technique to the patient, not the patient to the technique, see. And so some of that is you work with the patient, and you start out very, very gentle, very gradual, and then you build up as they can tolerate more treatment as it softens the scar tissue. And so that's what you just, everyone has to kind of be individualized. And then, you know, with Jim's put together some terrific protocols for treatment of carpal tunnel and neuropathy type cases and chronic disc problems, or if they've got a chronic knee injury or for athletic injuries. He's put together some protocols on DVD that doctors can reference and refer to. And if you've got specialty results with bizarre cases that nobody's treated before, like this one case we had with cerebral palsy and autism, this guy could not even walk when he came in. He was falling against walls, and they were going to put him in restricted living with restraints. That's how bad he was. And now he's walking normal. He can run normal. He's talking normal. His cognitive reasoning is normal. He's assertive. You know, he's got a girlfriend. His whole life has completely changed. And so when you help some of these cases, they'll follow you into the river. It's pretty exciting.
How soon did you see a positive result with that autism cerebral palsy young man? Was there a change in the first visit, or did it take 5 before you saw a change?
Well, within a month, he was dramatically improved. I mean, at first, you don't notice a dramatic change, but every visit he got better. And then he'd come in next week. I say, Chris, you're doing better. He shake my hand. He said, I'm doing real good, doctor. I know I'm doing really good. I said, wow, you're sure looking better. You're starting to walk better. And, you know, you start to notice when they walk in, they're more excited. They got a sparkle in their eye. He looks at you. He smiles at you, where at first he was kind of withdrawn and he wouldn't look at you. And now he's shaking your hand and looking you in the eye. I mean, it's unbelievable. That was pretty exciting.
In that month of his getting treatment, was he able to get in daily, or was he only a couple times a week? What do you recall?
No, he come in every day at first. And then after that, and then his mother was so excited with the results he had, she bought a unit, and she treats him regularly at home now. And I'm not sure how frequently she treats him now. I think he looks forward to it, and just he wants to keep going to see how much better he can get. It's not going to hurt you. You know, at the very worst, it's not going to hurt you. That's what's exciting about this. I mean, when you feel the muscle, when you feel the energy go through the tissue, and you're recharging nerves, you're recharging muscles, you're improving circulation, you're dilating the capillaries, you're softening scar tissue, and you're stimulating the energy that the body was made with. You think about the complexity of just one living cell with thousands of mitochondria, which manufacture ATP for energy and cell metabolism and protein synthesis and RNA and DNA and oxygenation in the cell and potassium and chlorine and sodium getting exchanged within the cell membrane. How all the functions of one cell and how all these cells get recharged. I mean, there's nothing that's not invasive that can accomplish what this does. And so if doctors say, you know what, our energy medicine is the wave of the future. I mean, our whole country, they say, oh, we need alternative sources of energy. Well, we need alternative sources of energy for the human body because people are polluting their body, and they've got old injuries, and then they pollute their body besides, and they're all biomechanically out of alignment, and they're living on dope. Well, I mean, that's the worst thing you can do when you've got chronic pain, and then you're doping it up on top of it. Why not throw, Hippocrates said, throw all your drugs in the chemist pot if you can heal the patient with food. You said structure governs function. Life only comes from life, the law of biogenesis. Why not work with these fundamental principles and laws that operate the universe and the human body, and let the body recuperate on its own? I mean, when you get 85-year-old people like this guy has no more leg pain, no more back pain, and medically they completely gave up on him. They couldn't. There was nothing they had to offer. And he drives 60 miles one way. He came in every day for a month, and all the pain's gone. Where he couldn't even lay on a table at first when he come in. So that's what's exciting, offering these people the care they need. And sometimes you got to motivate them. You got to tell them, okay, here's what it's going to take. You got to You got to do what I tell you, and if you do, I think there's a good chance it's going to improve and continue to improve throughout the course of care.
On the case of Chris with the autism, would you have done primarily a treatment that was directed at the head, or did you kind of go to 3 areas? How did you handle his case?
Well, he had a very abnormal gait. He had numbness and pain in the neck and shoulders. We did both sides of his brain. We did his neck and shoulders and arms, and we did his lower back and legs because he had electromagnetic short circuitry through his lower extremities. So we did all areas. But the brain controls the whole human body, so we did the right side, the left side of the brain, and on the upper back, and his arm function came back to almost normal, and his gait came back to normal. That was exciting.
Do you usually keep the machine turned down quite low? Because some of my patients seem to really enjoy a big thumping effect, and they kind of turn it up high. Do you find that a waste of time, or are we getting well faster when they're when we're able to tolerate the higher settings?
Well, yeah, they look forward to more higher setting as their tolerance improves. You know, at first we don't want to do too much.
Okay.
You know, until they feel it, so it's comfortable and they absorb it. You know, some people want to get well too fast, then you overdo it, and then they react. So I tell them we're going to gradually recharge these cells. In every visit, we can increase it a little bit, you know, and it's just like giving adjustments. If you pound a nail in a board and you have to pound it in a 1 hit, how many would you get done? But you got to do it regularly for a period of time and let the body gradually absorb the energy and recharge it and come back to where it should be. And so that we try to acclimate people to the proper care.
We have quite a few questions, and I'd like to keep you on, but Dr. Sue Massie would like to contribute something because she's been hearing a lot back and forth. Dr. Massie, would you please chime in?
Yes, thank you, Dr. Gordon. A couple of points that I just wanted to respond to also. You asked if any people react to the PEMF. The reaction that I see in the whole Lyme scheme of things, Lyme autism, is that people can occasionally come down with a cold, that once they start a treatment, the body starts to dump the toxins and so forth, and they create, the body's reacting and ridding itself, so they actually create a cold. I get that as often.
I've seen that happen quite dramatically, yes.
Yes. I have not seen where people herx. A Herxheimer reaction is when you get the flu-like body aches. When one starts antibiotics for Lyme disease, it's quite common to have a Herxheimer reaction where your body, the Lyme explodes, the body's got to absorb the toxins and so forth, and that's a Herxheimer reaction for the body to try to process what's going on. So I would not say a Herx reaction with the PEMF, but more a cold is more common. Also, you asked if the higher the number, the better. Again, I agree with Dr. Unruh that some people like to come in, they like to feel their body jolt, with the different coils and so forth, but the higher number is not going to get you better quickly. It's not going to be any more effective other than, make the body jolt, so to speak. At low frequencies, when you have the dial turned down, you're still delivering to the system the amount of energy that's needed to make a difference in the cellular structure. So I think that's really important also.
I think that I have another question here. One person is asking, which PEMF machine do you recommend? Both of you are using the machine that is seen on the web when you go to PEMF.us.
Yes.
That's the machine, and it confuses people because one you see there looks like it fits in an office, and the other looks like it fits in the barn. They're the identical same machine, and they're the same price. So I want to clear that up. In addition to that, there's a question here that somebody is asking, do either of you think the PEMF is working to reduce the electron deficiency, which is what my friend has written, Dr. Levy, about vitamin C being an electron donor, and that most chronic diseases are an electron deficiency. Would both of you feel that that's partly how PEMF is working, is that it's replacing or handling the electron deficiency of the body?
Well, I think it's helping the electron function, the body absorb it better, where it might not be as well with the cells that don't work the way they should. And
okay. The next question is, what do we know about the PEMF stimulating ATP? That will be presented at my conference this weekend when we have the top guy coming that does research at Johns Hopkins documenting beyond question that even Dr. Bindley's pad is clearly raising ATP, and that's static magnetic therapy versus the pulsed that we're discussing. Do we have evidence that our PEMF is actually killing bacteria, fungi, or virus? Anybody have an answer on that one?
Yes, there's much documentation on it. I don't have it right at my fingertips, but I absolutely do have the scientific proof that it does kill bacteria.
Good. Next question is, do we think PEMF would help deal with an underlying nutritional imbalance or even stop some of the food intolerances in people?
Well, I just invested in what they call a Revlon. It's a test that checks for 24 aldehydes, which are free radicals, your oxidative end product of oxidation, cellular oxidation. Free radicals are the biggest killers, biggest cause of cancer, biggest cause of heart disease, diabetes, degenerative diseases. And so a blood test only checks for one aldehyde. This checks for 23 aldehydes. And it's a spectrometography is what it is. You just blow into a tube, and then you break this tube, and through spectrometography it shows, because the lungs are an organ of elimination, and it shows so it measures all the free radicals in the body. So what we can do is we can get what their free radical level is, and after 10 or 15 PEMF treatments now, we'll retest it to see how it's improving. So we're going to do some studies on that to show how the cellular levels continue to decrease using PEMF therapy.
I'm convinced that PEMF is a key part of my advanced detoxification because ATP is the only way that you can have restored transmembrane potential and things like electroporation that will allow the cell to take up the nutrients so that it has the energy to kick out toxins. So I think that we are dealing with detoxification. Would Dr. Massie or Dr. Unruh like to add anything more about the detoxification effect? Next question. What do you charge? I think we've already covered that. I think that the doctors that we deal with are charging from $35 to $50, depending largely on the length of time of treatment. Does that kind of agree with you, Dr. Massie? Dr. Unruh, you've already discussed that.
Yes, I charge $45 for a treatment, but it includes multiple parts of the body, and it could be a duration. Sometimes I'm working with somebody for an hour, hour and a half. So I charge $45. I do a 6-pack or a 6 series for $240, and I usually give people the first one for free.
Good, perfect. I have seen evidence, because I've been studying the molecular biology involved in lasers, and I've been studying quantum physics. I believe that lasers are going to work dramatically better when you are having a patient who's restored their electron potential and their transmembrane potential. So somebody was asking, do we think that far infrared sauna, yes, it'll work better. Do we think lasers will work better? I have seen a dramatic increase in the effectiveness of my PEMF when I concurrently, at the same time, treating the same bad shoulder, treated it with a really good $2,000 laser treatment. It was amazing. It was like gone in one visit. So have you had, either one of you, any experience at adding laser to the use of the PEMF?
I don't, but I just purchased an infrared sauna, a medical grade one, and in 3 weeks I'll be able to tell you better as to, how it is affected, along with the PEMF. I feel these are definitely a big part of the solution to degenerative neurological disease.
Now, a question was sent to both of you. How do we see PEMF in relation to the earthing approach of Ober and my friend Sinatra, etc.? I need to state that Dr. Bindley, who is deeply involved in this specific area of research, namely the whole problem of earthing, states that the answer will be different for those living in an intensely urban area like New York City versus a rural area, and the answer could be quite different. So I wanted to set the stage so that all you would know that even though Dr. Sinatra is my good friend, and I'm so glad that he's brought back the simple concept of walking in the wet grass with bare feet, but I wanted to see, do either of you want to make any further comment about how PEMF might relate to the earthing approach?
In my situation, I live right across the bay from New York City, so I live in a very congested, very heavily populated, cell phone, power lines, et cetera, et cetera. It's funny because for 53 years I mostly walk barefoot. So I think naturally my body's just known to do that, and that's my comment.
Now I have a question, somebody saying if PEMF is too expensive for us, what's the next best thing we might do to help our clients? We will be discussing that at my energy conference this weekend, which will have 4 days of discussion of like truly Tesla therapy when we have muscle electrostim units that do amazing things and will restore as much as 10 inches in a thigh that is in a paralyzed patient. So people looking for other things, that costs $5,000, but it's rentable for $250 a month. So there's different things that we're looking at. And if we look at how do we see the use of fixed magnetic fields like the magnetic mattress in relation to PEMF, I just tell everybody that the Bonnley magnetic pad that I got over 10 years ago changed my life, and I am a totally different person when I'm able to sleep at home than when I have to sleep anywhere else in the world where I don't have my 400 pounds of 20 Gauss pads between my top and bottom mattress. So nonetheless, having had that for 10 years, it still did not cure my chronic 20-year standing back pain that had me stooped over so I could not stand straight for years. And so in less than 2 months, using PEMF daily, I have a brand new back and many other dramatic changes in my body, like a new set of kidneys and a new bladder and a new prostate and better urine. I mean, for me, I would think that when I see what people spend when they put mom or dad in the old folks home at $50, $60, $70, $80,000 a year, and there's no quality of life, and so many of those people treated with what we talk about, namely the combination of the right nutrients, the detoxing, what I call my FIGHT program, the right food, dealing with the infection, and the PEMF. But my suggestion is going to repeat that finally families are going to realize that in any given family today, somebody has got a breast cancer, somebody's got heart disease, somebody's got arthritis, somebody has an autoimmune. All you need is 4 people in a family, and if they each pay $125 a month, you've paid the $500 a month, and you can share the thing and get everybody well and keep the hospitals empty. But I don't want to keep all of you wonderful. Dr. Massie, Dr. Unruh, I can't thank you enough. I'm going to go through a couple more slides and invite all of our attendees to be back next week, when I will be doing an overview of all of the things that were covered during my 5-day seminar coming up starting Thursday nights. So I thank both of you so much for your participation today, and I'm just going to kind of view a couple things that I didn't complete in the thing, and I repeat. People are spending $25,000 on a wild goose chase that some kind of stem cell is going to do some magic. There is no magic in stem cells. I make my point very clear. I saved the life of the child that St. Louis Children's Hospital wanted to put a heart of a dead child in. They were going to do a heart transplant on an 18-month-old child. And I said to them, have you done anything to look at a deficiency of carnitine, which is known to cause massive cardiomegaly? They hadn't even measured and refused to measure. They won't do things. So I simply took my nutritional knowledge, and the child is blue in the intensive care ward, Children's Hospital St. Louis, 18 months of age, and they are insisting that it's an emergency and we have to do a heart transplant or what. Well, whenever I hear that it's an emergency, and they won't even answer questions, I said, have you measured magnesium? Have you measured coenzyme Q? They don't do anything. They're out to sell you a $250,000 heart transplant and a $50,000 a year program after that to keep your heart from rejecting. So I smuggled in quietly. We had a prayer healing ceremony, and we simply let the parents put under the tongue of this child whose heart was filling the entire lung, and the child had a blue color, but we put drops of the things that the child needed. And within less than an hour, the 180 pulse was coming down to 120. It's amazing. When you're young, the body really responds rapidly. So my only point is that people don't need to think, well, if you had done a heart transplant, how would the new heart be any better in a child who had a basic genetic defect in carnitine deficiency? The new heart would have failed, and you've spent $250,000. This is so nonsense. I get pretty mad with what goes on in medicine. And when you think about it, the huge epidemic of depression, it's really exciting to me because I listen now to doctor radio on Sirius Satellite 114 or XM 119. They're on 24/7. There's a modest fee. You can get it on your cell phone, but they cover psychiatry, they cover gynecology, they cover cancer. And so when you listen to the heads of departments of NYU Medical Center answering questions from the public, and you hear how they have nothing but a drug or surgery or some radiation, they never are fixing causes. So I just want to make the point very clear. They at Yale are now actually bringing people in to treat them with PEMF. That was the slide I showed you. So it's good to know that Stanford and UCLA are getting on board. But it's been around for so long, and it's not just for depression, folks. We're restoring what the body needed. That's why I'm making such a big point. And we know that we have an epidemic of people with osteoporosis, weak bones that snap and break, and we know without a doubt that we can help that. We can help it with the Tesla current. It's FDA approved for the electromuscle stim, and it rents. So if you can't get into the PEMF, but that's what I hope to do by bringing next week an overview again of energy medicine, because the pulse field is helping every condition. I don't care if it is the bone marrow mesenchyme stem cells. It will absolutely help in this area on differentiation of those cells. So every condition, you don't need to go out and take a wild chance and fly to a foreign country and give somebody $20,000 hoping that they're going to help you with stem cells. You first fix the body you've got and optimize everything. If you're sensitive to milk, putting another heart in isn't going to help that body. It's still going to be sensitive to milk or gluten. We've got to deal with the causes. In migraine, it's dramatic how well we're doing with PEMF. And Alzheimer's, I can assure you, there is no so-called Alzheimer's that is impossible to treat. That's all nonsense. If you read Whitehouse's book, it's called The Myth of Alzheimer, you will understand that Alzheimer and Parkinson's are no different than autism, which I have tremendous success in treating without question. That's why I have my FIGHT program, because there's always the heavy metals, the food sensitivities, the infection. It's always why I have on my website, Gordon Research, I have the program, 18 pages. Download it, and you'll know what I mean when I tell you that I have summarized. I have 8 hours of webinars to explain where you find which foods you're allergic to, what the infections are that we all carry. It's not just Lyme. Everybody's got CMV, and everybody's got Candida and chlamydia. But anyhow, we have to deal with the facts, and the facts are that PEMF makes everything go better, whether you're talking about depression or anxiety. And this is the case that Dr. Unruh treated. This is Chris that we've been talking about, and Chris's mother that bought a PEMF because she saw that her son that was about to be institutionalized because he couldn't walk straight, he had no balance, he couldn't complete a sentence, is now one of the great success stories that Dr. Unruh talks about. But we have this lady who bought a machine for herself because she'd been 9 years in a wheelchair. And after having this for 2 months, she walked into church under her own power, and the church members all stood up and clapped. So it's exciting to know that you can be a top athlete. And athletes have absolutely, they're being abused by the surgeons. They need to have access to this kind of treatment because virtually every injury will help much faster. But it's not going to get paid by your insurance. That's the bad thing. They're going to find a reason, because even though they've approved it now for depression, you can't say that because you got hit on the football field and you can't walk, that you're, even though you are depressed about being injured and you didn't win the game, you're still going to have to pay the bill. But fortunately, the doctors I'm talking to are keeping it affordable. And these are professional athletes. A bull rider who would have never been able to go back into his passion, riding bulls. These people, their lives are changed. Lightweight champion, these are people who, case after case, they are restored to go back to their life, and they didn't need a surgeon, and they didn't need a bunch of drugs. This is what we're talking about, pulsed magnetic therapy and how it can improve athletic. I treat my horses who aren't sick so that they won't be injured, so they stay flexible, and they have that extra energy so they can clear all the hurdles that we put in front of them. So horses do fantastically well. We can improve the inflammation in the horse or your back, which we show with thermograph. The hot area goes away and it becomes cool because it's no longer inflamed, because we treat the horse or your back or your foot or your ankle or your knee with these devices, whether it's the office or the portable. It's all one and the same. We're so glad that Dr. Unruh and Dr. Sue Massie have been able to join us today to make this whole presentation come to life. I hope more of you would be able to be with Dr. Pollack, Dr. Bonnley, Greg Westfall when we talk about True Testa, all the exciting presentations that we'll be doing the next several days, where we'll have a whole lecture room at this beautiful resort right here in sunny Tempe next to the Sky Harbor Phoenix Airport. And the conference is put on in conjunction with the Arizona Homeopathic and Integrative Medical Association. It will be exciting, it's affordable, but get your 18-page written by Scott Forsgren overview of the 8 hours of webinars that I have on my website, so that no one has to suffer with standard mainstream medicine that's merely giving you OxyContin when you'd really prefer to treat the causes. And all health professionals, no charge, join my discussion group. I send out 3 emails a day to 3,000 health practitioners to keep them up to date on the latest in diabetes, heart disease, and I can tell you that I have prepared a lecture on cancer that will knock your pants off. It will be given at ACAM, but we can tell you things, how to make vitamin C do things to every cancer better than anything you can get at any medical center by adding K3 and some other details. Hope you spend some time on the website, and we look forward to seeing all of you next Tuesday. And again, thank you to my contributors, Dr. Sue Massie and Dr. Unruh today.
Thank you, Dr. Gordon.
Thank you very much.
My pleasure.
Thank you.
Thank you, Dr. Gordon, Dr. Unruh, and Dr. Massie.
Thank you.
Thank you, everybody, for attending today. We encourage you to browse Dr. Gordon's website, which is www.gordonresearch.com. This webinar will be posted there within the next 24 hours for you to review at your convenience. You can visit our website at longevityplus.com or call 1-800-580-7587 for information about the products that we carry. Thank you so much, and everybody have a great day.